headed to a meeting. The group from Linfield College School of Nursing has arrived. But before we get started with our project with the group, we have a meeting because the act of actually building partnerships and creating alliances, focusing our future, it never seems to end. So I'm off to a meeting to work with a potential partner on a project. More to come. First meeting with our group. They actually all just went back. Here we are on the terrace. We have the groups almost universally stay at a hotel called the Lima Wasi Hotel, which is in Miraflores, an area predominantly tourist hotels. It's a little bit cloudy today. We're about to have lunch, and then we're going to head off to our first activity, which is to go up to the Shalom Center that Reverend Pat Blanchard runs in association with the Anglican Church. Our first day and our first activity with Linfield and the students from the nursing program.
So, similar to the first one where you bring now both of your knees to your chest, and this helps stretch it even better.
Y después de hacer una rodilla, haces las dos rodillas. Eso da más alivio todavía.
We're in the community of Nueva Esperanza, the New Hope. It's on the very outskirts of the formal city of Lima, and it is pretty much at the end of the road. One of the most impoverished areas in the metropolitan area of Lima, with some of the highest costs for living. The water here is exorbitantly expensive. It's all brought in by trucks, and the people have to pay for the water to be brought up. It's stored in these cisterns, these blue plastic containers you see by the side of all the houses. Most of the area doesn't have electricity. Very little of the area has desagüe or hygienic waste disposal. And yet there are people who make their lives every day. And we're working with the Anglican Church and bringing a group of nursing students to create community. It's like I've heard this 1,000 times, the same speech. Plaza de San Martin.
Simón Bolívar is a Venezuelan from the colonies of the north.
Touring with the Linfield group, just brought them to downtown Lima. This afternoon we'll take off and go to Arequipa and start the second phase of the work, which is more oriented toward our community-based nursing experience. For now, tourism in downtown Lima. Well, back for another video blog update. We're in Alto Caima, in the high mountains outside of Arequipa, working with Father Alex. Brought a team of students, nursing students from Linfield College School of Nursing in Portland. And we're partnering with students from a local university, Catholic University, in service learning experiences. This is actually a twofold project. Part of it's research. We're researching the impact of service learning on nurses and nursing student career trajectory. And then the other is just to bring nurses together from different cultures to exchange and to grow together. And we're really asking, we're sort of pressing the students to think in terms of how they define the terms poverty, health, well-being, and really begin to dismantle some of their stereotypes around these terms and how we use these terms. So a part of the trip is really about just sort of pressing into our biases. And I think that's one of the goals of Health Bridges International, is to press into the biases of the world, to sort of press against this sort of notion that the defining element of health is the absence of disease, and to say that health is defined differently by every person, and that we should all have the privilege and the opportunity to define health in our own way, and that part of doing that justice, part of creating that definition, that taxonomy of that for ourselves, is having the resources to be able to define it. So this next couple of weeks, we're here in Peru with a group of nursing students to help to really dismantle some stereotypes, to create cross-cultural exchange, and to begin the process of building greater bridges for health in some underserved communities. Students are going to be working here in Alto Caima. We're going to take them up into the Colca Valley, where they're going to do some health fairs, and they're going to be really pressed. They're going to move quickly from their area of comfort to some pretty significant areas of discomfort. And we think that's where growth is really going to happen. So join us over the next couple weeks. We're going to be posting a lot of short video vignettes from the activities. Thanks.